look great, right? No, really, this is fantastic. I want to tell you that yesterday was like beyond my imagination in terms of the success of it, right? A number one focus for us was to get the attention of the press, right? To just shed light on this crisis, the critical staffing situation that's going on every day, as you all know. And as of 2 p.m. yesterday, we got over 600 press hits across the country. 600. That's real. And sometime today, our website, you know, we're just so overwhelmed with so much, will be updated with some of the best articles and a link where you can actually see this list of 600 press, you know, Al Jazeera National, CNN National, even The Guardian in the United Kingdom, you know, had a story. It just really is extraordinary. Kaiser's so much on the defensive. You know, this guy Nelson that they've propped up there is telling a number of major just lies, right? Like their staff has increased by 25% and their membership's only increased by 6%, something like that. And 8, thank you. And we totally debunked it, right? For example, there's something up on our website that just totally debunks that and demonstrates that it's not true. I'm sorry? The actual number of staff when you look at FTEs is about 11%. But during this time, Kaiser's membership has grown by about the same. But it's more complicated than that in that 450,000 new Kaiser members in the last couple of years. A population that was largely uninsured, right? So they need more care. And over 100,000 folks that were that are on Medi-Cal, that we're using county systems. It's a population that needs an inordinate amount of behavioral health care, right? So, the good thing is that more and more press are really like digging deep into this and talking to us for long conversations. This Friday, we plan on doing a rally at the Department of Managed Healthcare in Sacramento, where we're going to take all the Sacramento folks and bring them there. The Sacramento press has just been tremendous. Yesterday, 3 TV stations most of the day. Great article on the Sacramento Bee today with pictures. So they're paying attention to it in an extraordinary way. San Diego yesterday, 6 cameras. San Diego strike. 3 cameras in LA, 3 in San Francisco, 2 in San Jose for most of the day. Just, you know, just tremendous press and great focus. What other questions do folks have?
Well, you did a wonderful job of the, I think it was a press release where you talked about the 11%, and you put, who else got that though?
Who else?
Who else got that information? Because I didn't hear that on the news. I only heard the 25%.
Everybody's getting the information, right? It's just going out so broadly. Just sent out another press release this morning where, you know, patients are calling us. They're overwhelming our website. It's great, right? That want help. So we're getting more and more information and more extreme violations of the law. So in a press release that's going out this morning, there's just like a list of examples in the San Francisco clinics, right, of just such horrendous, unnecessary suffering, you know, that patients are going through, you know, like sexual abuse cases. And there's a list of things that are going on where folks can't even get a return phone call for 2 weeks to get an initial, you know, screening, right, diagnosis. So it's clear to us that the situation's gotten worse and worse. So we're thinking about doing this DMHC thing on Friday because they're dragging their feet, right? This is the California agency that's supposed to be taking care of consumers, right? Not this corporation. And the amount of time that it's taken to get the new conclusions on their investigation is just inappropriate, right? So I'm just feeling like very satisfied, very secure that we're realizing our goals here in terms of why we decided to do this strike. You know, it really is focusing great attention on Kaiser, so hopefully it'll move them, right? So let's just have a successful week, and then right after it, we'll see if they've changed their position.
What's Kaiser saying about how many people stayed out, Ralph?
You know, I haven't heard, you know, like many reports on that.
Yeah.
And usually there's, according to our numbers, it's very tiny. right? Very tiny. With the exception of the optical lab, you know, in Richmond, just to be totally frank with folks, the strike is very strong all over the state. You know, it's all, you know, they're striking now on the 21st and 22nd. You know, they have a different strategy, so it's all about personal relationship. But please hear that the press we're getting never would have happened if we went on strike at the same time as them, just because of their numbers, right? So that was one of our primary goals, to get the press to focus on this crisis. When I just talked to just did a half-hour interview with a National Vision news service, and they're starting to ask the appropriate questions about, isn't this a national problem, right? And they're starting to, and what we're saying is, I believe that this strike will be a catalyst, right, to deal with this national crisis. Because several years ago, the federal government passed legislation that mental health has to be offered in parity with physical health, and obviously it's not happening. So the press asks, well, how come we're not hearing more about it in other places? And the answer is, mental health clinicians aren't in a union in other places. So it's the joining together in a union, right, to hold Kaiser accountable and have a voice. It's what's making the difference. And I really believe that to be true. I think that this is a historic week that's going to help, you know, like, deal with this on a national level.
Kaiser has said that we're just using this crisis as a cover for more contract issues. So, like, we do want to change the contract. So why wasn't that emphasized when we went on strike?
We're getting such attention to the staffing, you know, crisis, right? That's what people are really attention on. In terms of the other issues on the table, if they do come up and people ask questions, I say, you know, in terms of the economics, one, we're asking for the same raise that Kaiser's already given to 100,000 other Kaiser employees, nothing more, right? Two, we're asking to maintain the same benefits that we have today.
Yes.
That Kaiser promised you all when they hired you, nothing more. And this is an environment where Kaiser's profits are over $15 billion in the last 5 years, $32 billion cash reserve. You guys know these facts, right?
Yeah.
And then one of the things Kaiser's saying is, you know, there's a mental health clinician crisis. We're having a hard time recruiting. So if you're having a hard time recruiting and you're trying to encourage people to retire by taking away their retiree health, why would you, with the profits you have, right, want to reduce benefits if you're having a hard time recruiting and retaining people? And people get that, right? So that's kind of some of the discussion that we're having. Good questions. Yes?
So what happened with us and the nurses? I mean, for a while it seemed like, you know, there was this arrangement, and then it seemed like it fell apart.
Yeah, it's, you know, I encourage you to talk to RNs. I don't know how else to say it, but their top leadership, right, their top staff leadership, want to go it alone. They have their agenda. It's focused on RNs, and they don't have the same political will that we have, right, in terms of collaboration. It's simply that. I don't know how else to say it, right? They want it to be focused on RNs only. But I'll tell you, members of their executive board, you know, are questioning that. Because I think it's wrong too, right? We should be, and we're doing everything we can to finally coordinate with them. A week before we sent the 10-day notice, we met with them, told them what we were going to do, asked them to help, and they just decided they weren't in a position to do that. Yeah, the stationary engineers, by the way, are going out formally on strike this Friday. You know about that? Yeah, all the engineers this Friday have informed Kaiser they're formally going on strike. Okay? Thanks, folks. Keep it up, right?
Thank you.
Thank you.